Hello and welcome to a new episode of our EuroHealth podcast. My name is Jan Klusáček and our guests today are Lucia Goberna Lehmann. Hi. And Gisela Hansen Rodríguez. They are from an organization called Dianova. So please, if you can say something about the organization and what are your actual roles in it.
Well, thank you very much first for the invite. It's a real pleasure to be here with you. So just to present you in a few words what Dianova is, we are an international NGO. We're currently working in 19 countries in 4 different continents. And the main goal is to improve people's lives. So having that in mind, one of the main fields of work is prevention and treatment of addictions, where we have more than 35 years of experience. And we work in these fields at the grassroots level, so providing services in the ground. We have outpatient programs as well as we operate residential communities. And also we operate at the advocacy level, working in international forums and organizations that deal not only with drug policies, with health, with human rights and sustainable development. So all in all. So that's in a few words.
Could you say just a few words about your respective roles in the organization? So our listeners and viewers could have a better understanding of what you personally do.
Hi, I'm Gisela Hansen. Thank you for having us today. I'm director of Dianova Spain. I'm in charge of professional staff in drug treatment centers in organization, and I take care especially of the design and the implementation of drug treatment programs with a main focus on intersectional approach, rights approach. I also dedicate a good part of my time teaching at the University of Barcelona and to apply research in the field of, addiction, mental health, gender, and stigma.
And myself, I'm Lucia Goberna, and I'm in charge of the institutional relations of the organizations. I've been around since 2014, so quite a couple of years. And I deal mainly with the advocacy at the UN level, European Union, and also we work at other regions because we are in 19 countries. So, for instance, at regional forums such as the Organization of American States, for instance.
Okay, thank you. We know that there are many definitions of addictions. What is the definition what is Dianova approach to addictions?
To start with, we understand addictions not only in relation to substances, so also in relation to compulsive behaviors. And it's very difficult to summarize it as such because it's very complex, but we think there are 2 aspects that are very critical for it. One is the recognition from addiction as a treatable and chronic disease. And we do think it's important because having it as another pathology helps to reduce the stigmatization of people with substance use disorders. And also it increases the access to treatment. So this is very important. But only the biomedical aspect does not explain the phenomenon as such. So the second component, and I think the core one, is the biopsychosocial approach. Because as you know, the phenomenon is a very complex, multifactorial. And so there are very different aspects factors that range from the substances themselves, from the individual factors, from the environment, from the social cultural factors that affect as addiction as such. Because also in many ways, addiction is a coping mechanism in face of traumatic experiences. So that would help to explain. And so if we are, for instance, in a treatment program and we only deal with the drug consumption problem and not with the root of the problem, we're not going to advance. So that's why we always say that treatment needs to be holistic, need to take into account this wider range of aspects. And we are also very supportive of the continuum of care, because every person is different, every case is completely different, has different needs. And actually, the program should adapt to the person, not the person to the program. So I'm not sure, maybe Gisela, if you want to add anything, if I forgot.
Yes, actually, one program doesn't fit to everyone. Everyone has different needs. There's a lot of variable involving why one person is getting addicted to something. It could be a coping strategy for trauma from something that happened. Different things could influence how they start using the drugs, and that how they get addicted to that. So we need to consider all those variables and how we design the treatment for the person in order to be fully comprehensive and holistic and efficiency. So it's very difficult to summarize it in a few sentences because it's a very complex problem, and we want to highlight that it's not that easy. Just it's not only a matter of will to stop using something at some point. There's a lot of variables influencing that.
Okay, thank you very much. Lucia, you mentioned a very important keyword, and that is stigmatization. I know that your organization in 2018 launched a program called Bringing Addiction Stigma to an End. Could you just say a few words about that?
Yeah. Maybe Gisela, you want to go ahead?
For the beginning, I think stigma associated with drug use and the addictive behaviors affects people's life in a very transversal way, in a very general way. And not only to the person who has the addiction, their family could be affected for that stigma as well. We need to consider that in treatment programs and in prevention programs as well. Stigma generates a huge impact on physical and mental health, the ability to find and keep a job, to find and maintain a home, in their social relationships and self-concept. So the campaign that we designed, the main goal was to bring the stigma to an end, to try to overcome that view that, people user is one specific profile, is related only with poverty, with criminality, with the traffic. No, there is a lot of different people who can be involved in drug addiction at some point. We need to be more, we need to open our eyes to different profiles, different situations, and that anyone could be struggling with addiction at some point. And it is a matter of public health. It has a public health dimension that we should consider, not just that, a marginalized group of people who is dealing with that. So we try to overcome this kind of view.
And also from the sanitary point of view, I mean, when you start working on eliminating stigma, then you see that as it is compared to other pathologies, it should count with the public support of the authorities. That meaning the human resources, the financial resources, and also there is a lot of work to do on a stigma of people working with people with addiction, like even from the health sector or professionals from other that get in contact with them alongside the journey. So this campaign was really successful, and it's a campaign that we can replicate every year because unfortunately there is still a lot of work to do in raising awareness of it, but it touches upon many different aspects. So as Gisela mentioned, there is for the general public, but there is also for the authorities. There is a big component there because while dealing with the treatment of addiction, especially, we see that stigma is one of the main barriers for entering and actually staying in the programs. And this can be also applied to, for instance, to women that use drugs that are in treatment that face a particular complexity. So, it's a campaign that we will replicate, unfortunately, more times.
Yeah, and actually, this is something that is very difficult to understand, but it happens a lot that, stigma affects people's quality of life and make that people don't ask for proper help. There's a lot of shame, a lot of guilt around that stigma in drug use and drug abuse. So that make people don't really ask for the proper help. And it remains in silent a lot of years, and that make the problem chronic afterwards. So stigma has a huge impact on that.
Mm-hmm. And I guess it could be replicated not only every year, but in pretty much every country around the world, right? The situation is global.
Totally. And at the European Union level, there is a lot of awareness about it, like politically speaking as well. So stigma is recognized and that's included in the plans. Another thing is that not all that it's included in a strategy or the plan gets implemented. And I think that's where the trick goes, because when it comes to stigma, the problem is there is not only one action that can deal with it. It's how you include that in all the different, the design and the implementations of the different programs. So.
Is this stigmatization different in different groups of people with different social or age or maybe even ethnic backgrounds, or is it just the same widespread situation?
Stigmatization process in people who use drugs, we can deny that there is a huge stigma related to the drug use. But also it's true that from an intersectional approach, which take into account the different variables that contributes to make bigger that stigma, there is a lot of, combinations variable. It's not the same stigma that's suffering someone who is using, let me be specific about the examples, someone who is, high class using cocaine and having, the treatment in some specific place. There's someone who is homeless, is living on the street, is struggling with methamphetamine, which is a very low-cost drug. I mean, the stigma is amplifying when you're adding more and more variables of discriminations that could be poverty, ethnicity, and we cannot forget about gender. Women who use drugs had a very extra add penalty regarding to stigma. They suffer double stigma for being drug users and for being women who use drugs.
Okay, and what is how is the perception of this problem within the authorities? Do you think that authorities across EU consider that a significant problem that should be addressed, and do they even put enough budget and effort to dealing with stigmatization?
I mean, there are different layers. If I could say, let's go into the more global, the international one. At the UN level, there is recognition, but of course, I mean, countries have so many different approaches to drug policy as such that I couldn't say it's unified. I mean, stigma is being spoken at international forums since many years. But I'm not quite sure how that, as I mentioned before, how that really goes to the ground and how that it is developed. At the EU level, there is a recognition. It's in the strategy. It's in the plan of action of drugs of the European Union level. And I think, I mean, the EU as such is more prominent and more outspoken on this as in other regions in the world. This is clearly as such. Regarding the funding, well, this is an area that it's unfortunately not very well funded as such. But it's true that this is in the political agenda, at least I believe, and this is, I mean, I don't think that it's questioned anymore, but it needs way more support. And as I said, particularly in the design and implementation of programs. So not only in the good, nice words in the strategy, but how it really translates.
That is very difficult, actually. We talk about a lot about stigma, about, intersectional approach and all these fancy words. It, as Lucia mentioned, there is a goodwill in that, and on the paper, you can just write it. But it's very difficult to translate here in the day-by-day intervention. And, when it comes to stigma, we are just raised in this society and we grow up with a lot of stigma internalizing ourselves. So as a professionals, we really need to review that and how that is impacting our day-by-day intervention with people who use drugs. But you need to be aware of that, being conscious of that, and having time for that process. And usually professional teams, they had a lot of work. They don't have time to do this kind of specific training, and it should be considered in the political agenda to fund more specific training, for example.
And also one of the things is that I believe that in areas where people and services work with people who use drugs, this is well known, but the problem is outside those areas, So there should be a big effort made in talking about this and dealing with this with other professionals that work with people who use drugs, who are not maybe that aware of what stigma really implies to people. And also referring to at the political level, this is totally it. I mean, there is also a lot of stigmatization when it comes to language. And some of it also used by politicians or mainly the media. So there is, I think, a key component of raising awareness and just like really working a bit out of our fields, because we're not isolated. And that's, I think, a bit the challenge here, to get the message out of this sphere, out of this strategies and only actions that imply drug policies, but and also linking to what Gisela mentioned about this intersectionality approach.
Mm-hmm. And could you maybe elaborate a bit on what your organization does in communication with the politicians and the authorities concerning stigmatization?
We work, as I said, at the UN level. We have done a lot of work on getting these measures and getting stigma as a topic on the agenda. So, for instance, we are very present at the Commission on Narcotic Drugs since many years, and we've been organizing, for instance, events with member states and other NGOs about this concrete topic. I mean, about how it can be included in recommendations, in resolutions as such, but also how to raise awareness. Also publicly, for instance, we have advocated how media should better talk about this. And then we do a lot of work on gender and addiction. So we deal a lot with what Gisela was mentioning, this double stigmatization. And we are a part of working groups that, for instance, right now, actually, we're working on a document for the European Commission on how to better integrate gender perspective into drug policies and what that would imply. So this is a more really concrete technical aspect. And then, of course, we do awareness raising. We do campaigns such as Quit Stigma Now, and we collaborate in conferences and webinars. And at the region, at the national level, also, there is a lot being done, right, Gisela?
Yes, actually at the Spanish level, we do participate a lot in different platforms. I'm proud to say that the NGOs here are very strong energy in advocacy. We come together a lot in platform at the regional and national level as well. We do participate very actively in the National Catalan Federation of Drugs, or UNAD, which they are in constant communication with the policymaker at local and national level, which is very important to take. They ask for us, maybe not as much as we would like, but after they make a document and they're trying to change some kind of law, they ask for the NGOs, what do we think about that? This is useful. This is going to change the people's life in a better way. I consider that we have a very strong third sector here. The NGO, the civil society, is really engaged. But it comes from, the 80s, the public network in drug treatment was born because a lot of mother and fathers concerned about their kids' drug use of heroin at that time. They create a lot of NGOs, a lot of organizations, and was the seed of our, civil society power right now.
And also, when mentioning about the politicians, how to touch them, I think awareness raising, as we said, there are different ways. One is to making the connect to the people and to the phenomenon as such. And there's one way to inviting them to their centers, to get them to know people that have substance use disorder, to know their needs. So to touch the topic and know the topic. So leave it out of the paper, get it real. The other one is, and this is key, and it's providing evidence-based information and data that they can use for their policy making. Because unfortunately, when we talk about drug policies, this is still a very politicized area. Either we like it or we don't. It's the reality, and policies should be based on facts and evidence. And there is a big responsibility here, I think, from researchers, from academia, and also from policymakers to getting the right information and to using that. So I think that this other leg is also important in this conversation.
And another way to make it real as well is bring the politician to the places where people are, and also bring the voices of those people who has struggling with addiction or make a treatment and it was well. Make their voices be heard. They need to take participation in the public debates, in those webinars, in those places. We need to try to potentiate that. They have their own experience and expertise of the life experience, so we need to hear that too as well, not just the professional. Talking about evidence-based is very, very important, but at the same time, the experience of people needs to be heard.
Concerning stigmatization, I always felt that there is this absurd approach among many people that once you are searching for help, it is a stigma. It's not actually the actual abuse or the actual behavior, but the fact that you are searching for professional help, that is the stigma. For example, in Czech Republic, we have a very strong beer culture, and if someone drinks 10 beers during an evening, he's like really good guy. But once he searches professional help, then he's obviously someone weak, and which is absurd in my point of view.
And that's why stigma is really, delaying asking for help, because we all have image of the drug users related, with prostitution, criminality, narco traffic, and all that. Is related with media a lot, but if we all have that kind of image, it's very difficult to recognize ourselves as a drug users, if we have an addiction, because, as you say, I'm a good guy, I'm going to work as well, I take care of my house, whatever. So it's very difficult to recognize yourself when you really have struggled with addiction, because we have a very negative image that something should be like that. That's why stigma is really impacting on that. People don't recognize themselves until the things are getting very, very bad, which is not late, but it could be, earlier and better.
And just to maybe add the positive note, that's my personal thought, linking, for instance, with mental health, I think there has been a huge advancement regarding stigma, because a few years ago, even there wasn't a conversation about mental health as such. So there were just the pathologies, and also accessing, asking for treatment wasn't that seen. And right now, through the last years, I think there has been much more awareness due to COVID and due to the whole situation. That doesn't mean that it's properly funded, not at all, unfortunately. But for instance, just to bring also to this conversation, that the next 10th of October is the International Day on Mental Health. And for instance, we were preparing an article about stigmatization and mental health, and this brought me to bring this here in the light that I think we are on the right path. We should insist on working on this, because there is a way ahead, and I think we should keep being there.
Do you think that, let's say within EU, there are some countries that could be described as adopting the best practice concerning stigmatization?
Certainly are. I'm not well aware of the national programs in this sense, but there are certainly best practices in this area. And for instance, one of the aspects that Dianova is also working lately, it's on the rights of children, linked to their rights. As nowadays, their rights haven't been heard or listened when it comes to drug policies, whenever for instance, their parents or their tutors were using drugs. And for instance, this is one of the fields that is evolving now. And there are certain countries that are more pioneering, certainly. But I think it's interesting to see how the scope is broadening, and how we are including more aspects from the intersectional approach, but also other views on it, and how we are being conscious that drug policies affect many different people, many different communities. And I think that's a positive sign.
Yeah, but at the same time, it's quite challenging talking about, the kids, the parents who use drugs, and not giving a stigmatizing speech on that. That's quite challenging. We need to find a balance in order, to prevent, to point out that the children have the right to be protected from substance use stigma and the harmful effect on family, but at the same time, not being stigmatized with the drug users. So, yeah.
Okay, and well, let's imagine there are various levels of dealing with the situation. But what could be done on EU level? What could be done on national level? And what should be done in the general population? What would be the best approach from those actors? I know this is a really wide question, and you could respond for another 30 minutes. But let's point out at least one or two main aspects that should be concerned.
I think one of the things that has been evolving around this conversation is awareness raising, to talking about it in a non-stigmatizing way and normalizing in a way that, first of all, not every drug use is an addiction, and clarifying concepts. Because I think this is also very misleading when it comes to this field. So, and getting out of the field. So it's good that we speak with each other, that we deal with this in drug policy forums, but let's get out there. Let's get to health forums and speak about that. Let's bring the message farther away. So that would be one of my takes.
Okay.
Mm-hmm. At the professional level, I think is very, very important, the specific training and the supervision of professional staff in order to, open those spaces and talking about the stigma and the stereotypes that we have, regular people that we have been raised in this society. And try to overcome that. If we don't talk about it, we can destroy those stereotypes. So at professional level, that training, supervision, debating on that, and try to change our practices sometimes that we have heritage from other decades. And a regular citizen, I think we should try to, as well, to destroy those stereotypes and try to think about that anyone could be struggling with drug addiction at some point. And, be more kind and solidarity, understand that people who use drug is suffering and their families as well.
And also, of course, there are many things that can be done. But for instance, just to name some of the ones that we and other colleagues from NGOs are doing is, for instance, working locally with companies, for instance, let's say to help the companies identify and provide for assistance within the workspace, for instance. And this is also been done a lot with mental health. Just bring the message. And also, lately we are implementing a prevention program on addictions with and without substances for young people, and we are amazed with the worry that there is, for instance, from parents about addictions without substances, internet, gaming, gambling, whatever. And everybody knows, unfortunately, has somebody in their surroundings that have faced with that. And it's, as I said, normalizing the conversation, stop really labeling people, and touching them, reaching them.
Mm-hmm. And make the stories of overcoming addiction visible. Because people want to just get recovered and have done it very well, just hide again, because there's a lot of stigma. When you're an addict, you're always an addict, make the overcoming stories visible. There is a way out, there is a good life after that, and treatment works.
Yeah, and it's a process. That's also a complicated thing to explain. It's not a one way,
So that is something that I can take from this this interview personally as a parent to speak with my children about this topic and to explain them that it's no shame to ask for help, and that it's just an illness that needs to be cured. Okay, so thank you very much. I had a really great time with you, and I hope this is not the last time we see each other on this platform. Thank you.
And thank you very much for your work, because this is awareness raising. So this is thank you, Jan.
Thank you very much. It was a pleasure.
Thank you.